Gormagath Cian Corla, and I'll move the government's motion. I very much welcome the opportunity to speak this evening on this important debate on children's orthopaedic services with a strong focus on spinal services, to talk about what is working, what is not working, and what more must be done. I want to acknowledge the children here tonight. I want to acknowledge their mums and their dads, their brothers and sisters, their family and their friends. I have been meeting with them for several years, both in government and in opposition as well. And I have to say, I don't think I disagree with anything I've heard from the opening statements this evening. What is happening is inhumane. We, the state, over many years, have failed far too many of these children. And I can assure you I'm not standing up here today to say everything is fine. It's not. I'm not standing up to say everything that could be done has been done. It hasn't. What I want to do is I want to cover what has been done, where the ongoing failings are as I see them, and what I believe can be done and must be done to address those failings, because every single one of us in this House are united in our absolute determination to ensure that every child who needs these services gets them when they need them. Be that complex surgery in a hospital, be it equipment they need in their home, be it access to a physiotherapist, an occupational therapist in their community, whatever it might be, in their home, in their community, in their hospital, that they can get it when they need it. And we all know that for far too many children in Ireland, when it comes to complex orthopaedic care, that is simply not the case and hasn't been the case. What has happened is that the government invested record amounts of money in these services, in children's spinal services. What has happened is that the amount of surgery for these children is now at a record level and is being delivered by a record number of healthcare professionals. However, what is also absolutely the case is that the waiting lists are far too long. The time that the children have to wait is far too long, and that is the case, as colleagues have pointed out, not just on the surgical lists, which is what we focus on most, but also on the community-based care that these children need before operations, at times when they may not be suitable for operations, and after operations. In 2022, I committed €19 million specifically to children's orthopaedic care with a heavy focus on spinal care. That was for Crumlin and Temple Street in the main, and to some extent for Kappa as well. In 2022 and in 2023, I specified paediatric spinal care as one of just 3 clinical specialties in the 2022 and the 2023 waiting list action plans, and I'm doing the same again this year. So, not for a moment suggesting we are where we need to be. Nonetheless, some important progress has been made by our healthcare professionals. First of all, they've hired, with that money, they've hired over 200 additional healthcare professionals, mainly in Crumlin and in Temple Street. That's extra nurses, extra consultants, extra anaesthetists, extra radiographers, and more. We've now opened a 5th new operating theatre in Temple Street, again funded through this €19 million, and we've recently opened a 2nd MRI facility in Crumlin, again funded through the €19 million, and extra hospital beds have been added to both Crumlin and Temple Street, again from the €19 million, and Kappa has had investment. The amazing Kappa Kids programme has had investment to do more of what they need to do. What has happened is we have seen a very significant and important increase in the number of surgeries taking place in Kappa, in Crumlin, and in Temple Street compared to previous years, because of these extra doctors and nurses and other healthcare professionals, because we now have the 5th theatre as well. In 22, there was about a 1/3 increase in the number of spinal surgeries compared to pre-COVID. So that's an important increase. It's not enough, but it is an important increase. However, the reality is there are still far too many children waiting. There has been a very modest decrease last year in the total number waiting. It fell by 5%, not remotely enough. It's very modest. In terms of the number of patients waiting more than 4 months, the number is currently 78, and last year that fell by about 13%. Again, not what's needed, a very modest fall, but a fall nonetheless. And essentially everything we are focused on doing now is accelerating the reduction in the waiting lists and the amount of time that the children have to wait. I do want to take a moment, colleagues, to just acknowledge the very significant work that the surgeons and the nursing staff and the other healthcare workers have done to increase the number of surgeries over the last 2 years. We all know it needs to be far more. I've met them. I know Deputy Cullinan will have met them as well, and many of us will have met them. There are very good, very dedicated surgeons, nursing staff, health and social care professionals who are working harder to try and provide the care that is needed. While the progress matters, while the fact that the number of surgeries has gone well up matters, and there's been a modest fall in the waiting list, while that does matter, it is nowhere close to enough in terms of what needs to happen. In 2022, when I allocated the €19 million, the forecast I got from Children's Health Ireland was that it would bring the waiting list for those waiting more than 4 months down to 0, and it would do it quite quickly. And it was on that basis that we allocated the money. And as we all know, that hasn't happened. I've listened carefully to concerns that patients, that families have raised with me. I have consulted with clinicians about the allocation of that €19 million. I know that a portion of that money has been used to increase surgeries. It's very evident that that is the case. However, concerns have been raised that all of the money may not have been allocated according to orthopaedic and spinal surgery, certainly in the way that I intended, government intended, and I've no doubt all of us in this House would want to have seen. On that basis, I have asked the HSE to send their internal audit teams into CHI. I want a full account of the entire €19 million mapped against the intended purpose for that €19 million. Despite the record number of surgeries, what we've seen over the last 2 years, unfortunately, is a record number of new referrals onto the list. And it's more significant than I think many of us would have thought. For example, just last year, the extra number of children referred onto the spinal lists was over 40% higher than in 2019. 40%, 2023 versus 2019, a very big increase. And so what that has meant is that while a lot more surgeries are happening and more children are being operated on, this very big increase onto the waiting lists as well has meant that the waiting list has not fallen to 0. And in fact, the over 4-month waiting list only fell, as I said, by 13%. So to that end, there are several additional measures which I have directed my department and the HSE and Children's Health Ireland to undertake. A dedicated spinal surgery management unit has now been established, focusing on the management of the service, increasing volume, ensuring patient safety, reducing those waiting lists, reducing those waiting times. It's a cross-city unit, so between the various hospitals, we have a clinical lead, a very experienced orthopaedic surgeon who has agreed to lead this service. We have a nurse manager, and we have other supports in place to help this team. I've met the clinical lead to discuss the service and see where we need to go. And after listening very carefully to the orthopaedic surgeons, my direction to my department and to the HSE is that we are transitioning now to a dedicated spinal service in this country. As the surgeons have pointed out to me, that's best practice in places like Stockholm and other places around the world. What do we mean by that? We mean a dedicated theatre or theatres. In those theatres, dedicated nursing staff, anaesthetics and other theatre staff dedicated to the spinal service. It means dedicated recovery beds, dedicated ward beds and dedicated ward staff, specialists in spinal care. It's something we haven't had. It's something that the consultants have told me, in their view, is international best practice and what ultimately will provide the service we all want. And I'm allocating further funding this year to the clinical lead to progress that. I'm also intending to convene the stakeholder task force, which Deputy Cullinan referenced. I met some of the patient advocacy groups yesterday to discuss it, what they want to see, what terms of reference they want, things like independent chairs and other things. It was very constructive, and I'm very grateful for the time that those advocates groups put on. I want to acknowledge, Ceann Comhairle, that the co-design group, I don't believe it worked. I believe it was, unfortunately, it turned into something like a talking shop. None of us have any interest in that happening. We're going to have a very clear timeline, funded programme of work, and this task force will be meeting regularly to make sure that that programme of work happens. And with your indulgence, if I may, for one moment, Ceann Comhairle and Gura Magath, a few final points. We have two important reviews underway, a HICWA review into the use of the springs we're all aware of, and the report by the international independent expert, Mr. Nyagam. We are going to get recommendations out of that in terms of patient safety, spinal management, international best practice, what does work, what doesn't work. We will be acting on those recommendations. So to close, can I just thank Sinn Féin and Deputy Cullinan for tabling the motion. Can I acknowledge everyone who is here? It is an important debate. We are all absolutely determined that we will end the failure of these children and provide them with the care that they need. And can I just say, towards the end of this debate, Minister Butler will be closing for the government. I'm meeting the HSE board and the Chief Executive, and one of the things I will be bringing to them this evening is the feedback from around the House on the debate that we're having. Gura Magath, Ceann Comhairle.
Now, Deputy